Hello there. I'm going to be your doctor today, at least one of them. We kind of have to rush through this a little bit, but I assure you, you're going to be getting superb care from all of your various doctors that are going to be viewing you today. Yes. So I'm going to be your scalp doctor, if you will. Need to have a look at your scalp, your skin, your hair, even your hair follicles, just to make sure that everything is looking right. So I'm just popping on these gloves here, and I'm going to have a little bit of a scalp exam. I'm going to move quite close to you. I hope that that's okay. Okay, good. And I'm just going to look at your scalp. Any sort of irritation on your scalp lately? Okay. Any sort of dandruff, eczema, psoriasis? Good. Perfect. Okay, I'm also looking for any sort of infestations. Have you been in and around anybody that has had lice lately? Good. How often do you wash your hair? Okay, that's good. Yeah, that sounds about right. Please let me know if at any point if any of these spots are tender. They should not be. Do you find any differences in your scalp in different seasons? That being, winter versus summer, spring versus fall, things of that nature. Step aside here, and this is feeling quite normal, which is really good. I don't see any problems, and I'm not seeing any signs of any sort of infestation. That is really good. Okay. So as far as I can see, everything on your scalp looks as it should. You didn't feel any sort of discomfort? Good, that's just what we want to hear. And I don't see anything that we need to worry about. So we're going to go ahead and call the next doctor in, and they'll be all set for your next exam. Does that sound okay? Perfect. Hello there, I'm going to be your neurologist today. How are you feeling? Perfect. So I'm going to ask you to just look straight forward at me. I'm just going to look at your pupil dilation. Any history of any sort of brain injury, concussion, anything of that nature? Okay, good. Play any sports? Okay, any car accidents? Perfect. And can you tell me your first and last name? What about your date of birth? Okay, what city are we in? And the month? Perfect. Okay. You can puff out your cheeks for me. Don't let me push them in. Go ahead, stick your tongue out. Alright, scrunch up your eyes. Don't let me open your eyes. Good. Okay, don't let me move your jaw. Good. Perfect. Relax. Can you do a fishy face? Yes, exactly like that. Okay, you can stop. Good. Now, can you feel this the same as this? Okay. Can you feel this and this? You can. Okay. Does it feel the same as this and this? Okay, perfect. Just going to check a couple of your reflexes here on your face, so just to relax for me. Making sure that you blink. And can you tell the difference between my touch here and this metal here? Yes? Okay. Close your eyes for me. Which is touching you, my finger or the metal? Perfect. You can open your eyes. I'm just going to scratch down your palm now. Okay, perfect. I'm just going to tap on your jaw here. And your chin. Perfect. Go ahead and smell this for me and tell me what it smells like. Peppermint. Good. Now what about this one here? What does this smell like? Coffee. Perfect. Alright. I'm just going to kind of move your head a little bit. Can you count to 5 for me? Perfect. Okay, just stare right at me. Can you tell me which finger's wiggling? Oh, both. I gotcha. Perfect. Alright, so I'm thinking that you are cleared. Nothing seems to be wrong with your brain, so I will go ahead and let your next doctor know that you are all ready for them. Perfect. Hello there. I'm going to be checking your eyes today. Is that okay? Perfect. So to start with, I'm just going to have you follow this light here. Follow. Follow this light. Yep. Keep your head still and just follow the light for me. Perfect. I'm going to move a little bit closer to you. I'm just going to check your pupils. Do you wear glasses or contacts? Okay. And when's the last time you had an eye exam? Okay. Any sort of eye surgery? Okay. Okay. Good. If you don't mind, I'm just going to grab one of my different lights and I'm going to look at the back of your eye, okay? So just look right at my nose. Okay. Same thing, right at my nose. Okay, and can you follow this dimmer light for me? And are you able to track that okay compared to the brighter light? Perfect. Now, stay looking at my nose. Can you tell me how many fingers I'm holding up? Good. 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 Okay, perfect. Stay, look right at me. Tell me which finger wiggles. Perfect. 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 Exactly. Alright. Covering your right eye, can you go ahead and read this third line for me? Perfect. Can you read this line here? Alright, perfect. Go ahead and cover your left eye. Okay. And if you can read this second line for me. Alright. And can you read this fifth line? Perfect. And now with both eyes, can you read the bottom line? Alright, perfect. A couple different swatches here. I just need you to tell me what color these are to your best ability. Okay. They are different shades, so what color shades are these? They're green, perfect. Which is darker? This one or this one? This one or this one? Exactly. Okay. Can you tell me what shades these are? Yes, they're blues. And which is darker? This one or this one? This one or this one? Perfect. Last one. What shades are these? Perfect. And which is lighter? This one or this one? This one or this one? Exactly. Wonderful job. Okay. Can you look at the back wall for me? Alright, perfect. You're all set and you're ready for your next appointment. Hey there. I'm going to be looking at your teeth today. Can you smile great big for me? Beautiful smile. How often do you brush your teeth? You can tell me the truth. I know a lot of people like a lie. Alright. I have this little brush here. I'm just going to poke along your gums and in between your teeth, okay? So smile great big. Let me know if there's any sort of discomfort. When's the last time you had a dental check? Okay. Was that a cleaning? Okay. Well, your teeth are nice and pearly white. I love to see it. Exactly. I don't see any sort of swelling in the gums or any bleeding, which is really nice too. Okay. Have you had any sort of oral surgery or anything of that nature? Okay. Perfect. Just keep your mouth open for me. Say, ah. Look at the back of your mouth. Look at the back of your mouth here. Good. Good. Okay. Okay. Now, are you doing anything extra besides brushing your teeth? Are you flossing? Are you gargling with anything? Okay, perfect. Well, it is always a wonderful idea to go ahead and floss those teeth as well. I'm going to do that for you today. Just grab a little floss here. This is bubble gum. Is that okay? Perfect. So, gonna keep your smile nice and big for me. And we're just gonna floss these teeth there. Good. How's that feel? Good. Okay, just about finished here. Just a little bit right here. Okay. Smile for me. Perfect. And you're all set for your next appointment. Hello there. I'm going to be looking at your ears today, examining your ears and your hearing. Perfect. Any sort of pain or discomfort with either side? Do you wear any sort of hearing aid? Okay. Good. Yeah, you're just going to feel my light touch here. Please let me know if anything is sensitive. It really shouldn't be. Okay. Perfect. Okay, I'm just going to snap my fingers. Could you tell me which side I snap on? Okay, so no problems there. Let me just pop a glove on real quick. I'm going to have a look at the inside of your ears. When's the last time you had an ear cleaning? Okay. They're not super common. We do recommend them in some cases. People always need to be careful about doing any sort of cleaning at home, though. Sometimes they can go a little bit overboard with that, so please be careful with that. Okay, I'm just going to put this light in your ear. See? Okay. Alright, I'm going to do the other side, so please just sit still for me. Wonderful. I don't see anything that should be of concern. Okay, so can you tell the difference? Yeah, so closed, open, closed, open, closed, open. Can you feel the pressure difference on that? You can. Okay, perfect. Now, I'm going to brush my fingers, little butterfly fingers, around each ear. Can you tell me what side you hear it on? Good. Perfect. And tell me when you stop hearing it. Perfect. Tell me which side you hear the snap on. Okay, and when's the last time you had a generic hearing test? Okay, that's totally fine. I'm going to whisper a couple words in your ears. If you could just repeat them back to me. Perfect. Alright, so sleep. Purple. Triangle. Banana. Ocean. And you can hear that okay? Okay, and you responded really nicely to the various sounds and being able to repeat those back to me, and I'm not seeing any sort of concern in either side of your ear. No sort of discomfort as I touch your ears. No. Okay, that's wonderful. I think that your ear health is just fine. Alright, I'll go ahead and send the next doctor in. Well, hello there. I'm going to be your dermatologist for the day. Can you describe your skin for me? Is it dry? Is it more oily? Do you suffer from things like psoriasis or eczema? Are you acne prone? Combination? Okay, Perfect. I'm just going to have a feel of your skin and kind of look at what we need to work on and how we can improve your overall skin texture. Exactly. Okay. Do you have a skincare routine? Any sort of products that you use on a daily basis, or to wash your face, to moisturize, anything like that? Okay, that's understandable. We can definitely work with some particular products to get you the goals. Okay. Good. Now, just to get a little better look, I'm going to look a little bit deeper, if you will. So just hold still for me. I just need to look. Yeah. Just getting the texture and the feel to your skin, and even down into your chin and your neck, of course. Okay. How often would you say that you exfoliate your face? Okay. Do you do any sort of at-home mask routine? Okay. Good. Always want to make sure that we're not overdoing those type of things, because it can at first seem like it's going to help your dry skin or your acne-prone skin, but it can make the problem worse. So we need to be very sensitive to those type of products as well, of course. Okay, good. So I do have one product that we're going to pop onto your face right now and just kind of see how it does. Okay, so to start off, I'm just going to spray this a little bit here. Okay, let that dry real briefly. And just have this basic cleanser that we're going to pop on to your face. It's really good for a lot of different skin types, so it'll be a perfect starting point for you until we assess and see really the main goals for your skincare. Exactly. Alright, so we're just going to go ahead and let that soak into your face, and you are all set for your next doctor. Hello there, I'm going to be your cardiologist today. Are you having any problems breathing today? Any sort of heart palpitations? Oh, that's good to hear. Okay, I'm going to just take my stethoscope here, and I'm going to be listening to your heart and your lungs. Make sure it's not too cold for you. Just go ahead and breathe normal for me as I listen to your heart. Any sort of heart problems in your family? Okay. Now I'm going to listen to your lungs. Breathe normal. Any sort of asthma, chronic bronchitis, anything of that nature? Are you on any sort of inhaled steroids? Okay, good. Take a nice deep breath for me. We're just going to reach around the back. Take another nice deep breath for me. Yep, just keep breathing nice and deep for me. Good. Okay, hold your breath for me. 3, 2, 1. Breathe. Okay, hold your breath again. 5, 4, 3, 2, 1. Perfect. Alright. Your heart and lungs are sounding really good. I'm just going to get your pulse real quick. Are you nervous at all? Okay. I just like to ask because sometimes our pulse can be a little bit agitated in a doctor's type setting. Okay, you sound just fine. Okay. I'm just gonna feel your chest real quick. Perfect. I'm gonna step behind you and I'm just gonna tap down your back. I'm going to put my stethoscope back on, and if you could say 99 every time I move my stethoscope, that would be perfect. Okay, ready? Thank you. Thank you. Thank you. Thank you. Perfect. Okay. Your heart and your lungs sound super healthy. I don't think there's anything to be concerned about there. I will go ahead and let the next doctor know. Perfect. Well, hello there. I'm going to be your plastic surgeon for the day. How are you feeling? Fantastic. So this is your first appointment with us, correct? That's what I thought. So just to start, I want to kind of examine your face while you kind of tell me what you're looking to have done. Okay. Have you had any sort of plastic surgery before? Okay. Any fillers? Any injections? Okay. Good. And what are your goals for your face here? Okay, I see. That's very common. Okay. And just wonder, have you tried any topical treatments to try at first? Of course. Okay. Perfect. I always like to recommend that we go the topical way before we look into fillers or surgery or anything of that nature. Okay, let me just feel here. Okay. Perfect. Gotcha. So, as we continue with your consultation process, I do want to go ahead and get some before pictures and some before measurements, just so we have kind of a starting line of where we're going to go from. Okay, so just look straight here. Good. Now turn a little bit to the side. Perfect. And now a little bit to this side. Perfect. Look up. Look down. Now all the way to the side. And all the way to the side. Perfect. So those are going to be perfect for your file. I do want to go ahead and get some measurements of some of your facial features as well, just to document as we continue the consultation process, of course. So let's just get around your forehead here. Okay. Down the bridge of your nose. Your eye. Okay. Okay. So a little less there, a little more there. Okay, is that what I'm understanding? Okay. Perfectly doable. Alright. Well, that is just perfect. Great starting point for us, and I'll add those measurements and pictures to your file, and we can go ahead and continue the consultation process and move forward to a good time for your surgery date. Exactly. Until then, I believe the next doctor is all set for you. Hello, I'm going to be your chiropractor today, so I'm just going to have a brief look at you, see if you need any sort of chiropractic adjustments or anything of that nature. Have you seen a chiropractor before? No, alright, so I'm just going to look mostly at your neck and your spine, of course. Alright, perfect, so if you can just hold still for me, I'm going to take hold of your head and we're going to move it back and forth. Alright, any sort of tension there? That's good. Alright. Can you describe a regular day for yourself? Do you normally sit? Are you standing? Alright, so that makes perfect sense. Okay, I'm just going to reach around you, kind of feel down your spine. Good. Perfect. Good. You find that your muscles are tense quite often? Alright, of course, that's fine. Okay. Good. Can you just kind of lift your arms up like so? And kind of twist your body? Any sort of discomfort there? And kind of the other side. Alright, keep doing that. I'm just going to hold on to your hips here and see if I feel any sort of unnecessary movement. Alright. If you had to describe where most of your discomfort comes from, would it be head, neck, shoulders, spine, hips, legs, feet? Alright, perfect. So I'm going to once again take hold of your neck here. I need you to try and relax as deeply as you possibly can. Of course. Now, I'm going to do some slight movements to kind of adjust your neck down into your spine. Then I'll move behind you and do some down your back. Perfect. Are you ready? Alright, here we go. Would you prefer that I just do it or I count down? Twist here, got you. 3, 2, 1. Good, that was a really good one. Alright, I'm going to do the same on this side, so we're just going to twist lightly. Good. And 3, 2, 1. Brilliant. Alright, I'm going to go behind you. So, I'm just going to feel down your spine. Any pain there? Alright, would you prefer that I count again? Here we go. 1, 2, 3. Good. 1, 2, 3. One more. 1, 2, 3. Perfect. Right. Let me check the movement of your neck. Oh, much more smooth. Okay, good. You should feel much more relaxed now. That went perfect. Go ahead and let your next doctor know that you are ready for them. Hello there, how are you feeling today? A little nervous? That's to be expected, but don't worry, you're in great hands. I just need to confirm some information from you. Can you tell me your birth date? Your first and last name? And in your own words, what surgery are we doing on you today? Good. You are you. Perfect. Now, to start off, I'm just going to go ahead and put an IV in your hand. You don't have to look if you don't need to. It's going to be real quick for you, alright? Do you want me to count down? 1, 2, 3. Perfect. Okay. I'm going to go ahead and put the oxygen mask on you now. And then we'll have you count back. And before you know it, you're going to be in a deep sleep, okay? Perfect. Alright. Are you ready? Perfect. Okay. Here you go. Take some nice deep breaths for me. And let's go ahead and count down from 20. I'll do it with you. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.